I would like to talk to you guys about lateral epicondylitis, or also known as tennis elbow. This recent newsletter is talking about the difference between lateral epicondylitis and lateral epicondylosis. Just to reiterate that, lateral epicondylitis is more of an acute type of injury that occurs within that first week, where it's more of an inflammation on the outside part of the elbow, versus lateral epicondylosis is where you actually get a thickening of the tendon from more of a chronic type of overuse. Typically, epicondylitis can clear itself with rest, ice, and some type of over-the-counter anti-inflammatory, whereas lateral epicondylosis is one of those instances where you're taking the NSAID, you're icing it, and it's not getting better. How that occurs is that your common form extensors here, as well as your rotators of your wrist, which if you think of a tennis hit, you use those a lot, all insert right into that portion of the elbow here. And in that lateral epicondylosis, the tendon will actually start to thicken. And when it thickens, it starts to lose some of its elasticity and acts more like a rope, yanking on that insertion point, creating what's considered a repetitive injury cycle and chronically building up inflammation, thickening, building up inflammation, and thickening. A way to treat that is through things such as active release technique, but what I'd like to give you guys at home are some strategies you can do at home to try to relieve that. First thing you would want to do is get some type of soft tissue tool, a lacrosse ball, golf ball, whatever's easier for you, and actually go back and forth on that tendon, trying to loosen that up. You may also try to do that with an ice cup. Not a big fan of the ice cup because you don't want to freeze the tendon out as much either. The goal is to break this up and get some blood flow into that. After you kind of work that muscle out and get it moving, you want to grab something that's about 1 pound. I'm ad-libbing with a salt shaker here. And you really want to get your elbow kind of braced here, so you're just using your wrist. And you want to do light, up, down, side, side, up, down, side to side. You want to do that about 10 times for about 2 sets, going all directions, up and down. After that, you want to do some light stretching, pulling it this way, holding for about 10 seconds. Rotate the arm out, and also do some light stretching here. The goal here is to go to when you feel pain and then back off a smidge. That way that tendon can relax. Thanks.